Hello, and welcome to Guro Immigration, where we're here to help newcomers in Canada thrive. I'm your host, Alicia, and today we're embarking on a journey to understand one of the most crucial aspects for newcomers, navigating nurse licensing requirements in Canada. Canada has been facing a nursing shortage, and the pandemic has only made it more challenging. In fact, it's projected that by 2031, there will be 155,400 open nursing positions. The recruitment and licensing of internationally educated nurses, or IENs, is a significant part of the solution. The Canadian government, nursing regulators, and various stakeholders are fully aware of the urgency of this situation and the challenges IENs face. They are actively working on streamlining and speeding up the licensing process for IENs. The good news is that there have been positive developments in provinces like Nova Scotia and Alberta, where innovative measures have been taken to address the nursing shortage. Now, let's talk about how you can navigate the path to licensure. Different provinces have implemented unique pathways. For instance, in Nova Scotia, they've introduced expedited pathways for nurses from various countries, significantly reducing the processing time. In some provinces, nursing licenses obtained in one province are recognized in another, making it easier to seek employment opportunities across Canada. Overcoming challenges. We understand that the journey can have its challenges. For instance, language proficiency can be established by having worked in an English or French-speaking healthcare facility, even if you haven't passed the language proficiency test. Reforms are making positive changes, and we're already seeing significant numbers of IENs finding their way into the healthcare sector. The types of nursing licenses. It's essential to understand the different types of nursing licenses in Canada. There are 4 regulated professions: nurse practitioner, registered nurse, RN, licensed practical nurse, LPN, and registered psychiatric nurse. Each has its own set of academic requirements and scope of practice. The pathways to licensure. Now, the pathways to licensure can vary. While some provinces directly hire applicants from other countries, most IENs arrive in Canada and work closely with provincial nurse regulators to obtain their licenses. It's essential to ensure you have all your documentation prepared before arriving in Canada. Guidance from licensing bodies. After the permanent residence process is complete, consult the provincial nursing licensing body for a step-by-step guide specific to your nursing specialization. The requirements may differ between provinces, so stay updated on the latest information. Nursing regulatory bodies. Each province has its own nursing regulatory body for different categories of nursing. These bodies have specific requirements, including education, registration exams, language proficiency, and more. Be sure to visit their websites for detailed information. Evaluating your credentials. To start your journey, you can use services like the National Nursing Assessment Services, NNAS, for an advisory report that assesses your education and competencies compared to Canadian standards. This is your first step in understanding what's ahead. Language proficiency. Language proficiency is vital. Different provinces accept various language proficiency tests, such as IELTS and CELBN. Be aware of the expiry dates for these results, as they vary by province. Registration exams. The registration exams can be a pivotal step. These exams are taken to determine your qualifications and competencies. Upon successful completion and meeting all regulatory requirements, you'll receive full licensure to practice as a nurse in Canada. Post-licensure steps. After obtaining your license, the doors open to employment opportunities. Some provinces even allow conditional licenses, giving you a chance to gain experience while working towards permanent licensure. Partnership programs, mentorship, and support groups are here to guide you. Continuing professional development. Professional development is a must in the nursing field. Becoming a member of the Canadian Nurses Association offers access to diverse clinical specialization certificates, helping you stay competitive in the job market. Understanding the costs. The cost of licensure varies by province, and it's important to plan for it. Some provinces offer bursaries and grants, while others provide financial assistance for IENs. Explore your options, and you may find support that eases the financial burden. Friends, navigating nurse licensing requirements in Canada is a significant step for internationally educated nurses. Remember, you're not alone on this journey. Thank you for joining us today. See you in the next video. Bye for now.